Now, in recent months, there has been a significant increase in pneumonia cases across the Philippines. That is raising serious concerns within the healthcare community. Now, joining us today via Zoom is Dr. Jose Rene de Grano, the president of the Private Hospitals Association of the Philippines Incorporated, to discuss the current state of pneumonia care in the country and the role of private hospitals in addressing this rising health concern. Magandang umaga po, Dr. De Grano. Thank you very much for joining us.
Yes, it's a beautiful day, Paolo, Monique, and Anne. And yes, good morning.
Doc, let's start off first with talking about the pneumonia cases here in the Philippines. It felt like just a few weeks ago, a few months ago, it felt like everyone either had it or knew someone who has had it. Is there a spike? Is there a surge in terms of the numbers when it comes to pneumonia cases, especially those treated by private hospitals?
Well, there is a little bit of an increase noted among the hospitals, primarily because of the changes in weather conditions. For the past, I think, 1 or 2 months, a lot of rains. Medyo ang weather natin is not that good, no? So that's why we expect the highly vulnerable parts of the population, like the young ones, and then of course the elderlies to well, usually they're the ones that get this pneumonia
Mhm.
thing.
Well, you mentioned it was weather related, and when you take a look at the way that it's being treated, being diagnosed, are there any challenges or significant challenges that hospitals typically face when addressing pneumonia?
Well, of course, right now the private hospitals are ready for that. It depends on the source of the or the cause of the pneumonia. If it's only viral, usually it's only supportive. We just give medications for fever, medications for additional, hydration. But then if it's caused by bacterial pneumonia or bacteria and then fungus, and then that's a different case because we'll have to treat them using antibiotics. And usually these antibiotics cost a lot.
Mhm.
Yeah.
You mentioned that a lot of the affected populations or affected patients are typically those are at risk, children who are
Mhm.
in certain situations, even the elderly. And for those who are concerned about those more vulnerable people, how can they help prevent the spread of pneumonia for them in particular?
Well, of course, we have pneumonia vaccines. These are available in our country. Usually, they are given once a year. But for the elderly, they can give pneumonia vaccines, which are good for the next 5 years.
Mhm.
And these are the pneumococcal vaccines. And I think these are quite available in our hospitals.
Well, you mentioned the vaccines. I actually want to talk about the technology involved in treating pneumonia, especially here locally. How in step are we, in your opinion, with regard to how we treat pneumonia in the country compared to the rest of the world?
Well, I think we're up to the rest of the world. As long as we have the proper antibiotics, then we can treat our pneumonias very well.
Mhm.
The hospitals are ready. They have all the antibiotics, the medications, the instruments, I mean, the equipment for this pneumonia. And so it's only the availability sometimes of the pneumococcal vaccines. And right now, I think they are available.
Mhm. So let's talk more about pneumonia, but in a different lens here, because pneumonia actually
Mhm.
has made the news as of late, simply
Yes.
because of Pope
Absolutely.
Francis has been affected with what they call double pneumonia. Now, for those who don't quite understand what that is, could you give us siguro a layman's
Yeah.
explanation of what double pneumonia is and why is it so difficult to treat?
Well, the human beings, we have two lungs, So if sometimes usually the pneumonia is affecting only one part of the lung, and then of course, in the case of the Pope, I think both lungs are involved. And so it's double pneumonia. And then, of course, it was very hard to treat, because probably sometimes the bacteria affecting the lungs are already resistant to the antibiotics, and so that's it.
Mhm. And of course, all going to be hoping for his recovery as well.
Yes, of
But
course.
let's also focus on something that's another thing that's made the news here. That personally, it shook me a bit because we're talking about another potential form of coronavirus, which is, I believe, the bat coronavirus that has been found by a Chinese research team that has the potential to be transmitted from animals to humans and uses the same receptor as the COVID-19 virus. When you take a look at that type of news, that type of development, what are your initial reactions? What does it actually mean? And how worried should people be when they read something like that?
Well, of course, it's still not, it's not prevalent yet. I mean, it's not even documented among humans. But then, of course, just because the mode of transmission is very similar to COVID-19, and COVID-19 caused a pandemic worldwide, and so that's the problem, and that we're trying to expect that hopefully it will not be the same as the COVID-19, because that will entail a lot of risk among us. But right now, I think we should just be aware that this wildlife, including bats, may pose a lot of threat to our body. Yeah.
Well, sort of from a hospital perspective, when you hear news like that, and we already experienced a pandemic very recently, in terms of preparedness, has the latest pandemic that we all experienced together changed the way that we prepare moving forward for any other potential outbreaks, or at least in terms of trying to
Yes.
contain any potential outbreaks?
Yes, of course we are, and we are now more prepared than ever, because everybody was, they were caught unaware of the COVID virus, But then right now we are already prepared for that, and even probably this new, hopefully it does not come. This new bat virus should, if ever they will come again, or come here and affect the humans, and we should be ready. I think they are already preparing something like a vaccine for that, just in case
Mhm.
it happens. Yeah.
Well, he is Dr. Jose Rene de Grano, the president of the Private Hospitals Association of the Philippines Incorporated. Thank you so much for joining us this morning, and we hope to talk to you again soon. Magandang umaga po.
Good morning, Paulo, and the rest of our viewers.